Today we're going to talk about Viagra and Cialis. These are the two most popular medications used for erectile dysfunction, so we'll discuss that. We'll discuss some alternative uses and some interesting things. Let's get into it. First off, we're going to talk about Viagra. The chemical name is sildenafil. So primarily it's used for erectile dysfunction, and the causes of erectile dysfunction are usually poor health, so high blood pressure, diabetes, obesity. It can also be caused by certain medications or anxiety. There are other medical conditions that cause this as well. It's also used for what's called pulmonary arterial hypertension, which is high blood pressure in the lungs, that's circulation in the lungs. Its original use, I believe, was for chest pain, but over time, it was evident that it was very useful as an erectile dysfunction treatment. So let's take a little bit of a dive into how Viagra works. So this is a cross-section of the penis, and what I have circled are these spongy cavities called the corpus cavernosum. This is what fills up with blood, causing an erection. When this spongy tissue doesn't fill up with blood, then there is no erection, and that's the issue with erectile dysfunction. The blood flow isn't optimal, and so these drugs help that blood flow in there, thus causing an erection. What these drugs do is increase the amount of this compound cyclic GMP, and we'll talk about that towards the end of this lesson. This causes the relaxation of certain muscles, thus allowing blood to flow more freely. It takes about 20 minutes for Viagra to work, and it lasts about 3 to 4 hours. What's important to note is that you need sexual arousal to initiate the effects of this drug, and this is the same case for Cialis. And we just said that it increases blood flow into the corpus cavernosum. Now this drug is best taken on an empty stomach. Next up, we're going to talk about Cialis, or tadalafil. Cialis is used to treat erectile dysfunction, pulmonary arterial hypertension, just like we talked about before, but it's also used to treat what's called benign prostatic hyperplasia, or BPH, which is an enlarged prostate. Here we have a male bladder. We know it's male because at the base of the bladder we have the prostate that wraps around, and this is the sexual organ that produces fluid for semen. Right here we see this nice opening in the urethra. When you have enlarged prostate, this prostate squeezes on the urethra. It weakens the bladder muscles, it causes a strong urgency to urinate, urinary accidents, frequent urination, especially at night, etc., etc. Now, this is not painful. It looks like it's painful. It's not. This can occur with a lot of men as they get older. It can also occur for a variety of other reasons. And Cialis is used to help treat this. Now, from what I understand, the mechanisms aren't fully understood, but it is used as a treatment. And I believe it's used in combination with some other drugs for this condition. Its function is the same as Viagra. A distinct difference, though, is that it takes about 30 minutes to kick in, but it lasts for about 36 hours. This is one of the primary differences between this and Viagra. It's the amount of time that it can work. So both are used in just different situations, as far as the initiation of sex, etc., etc. And this can be taken with or without food. So let's talk about some of the recreational use. So Viagra is the most commonly used recreational drug for erectile dysfunction. Now, what's important to note is that from the research I've done, it doesn't seem to really do anything for men that do not have erectile dysfunction. You might be listening and you might be a man that is taking this drug that doesn't have erectile dysfunction. There's a lot of men who have done this and say, hey, it works. What seems to be the factor is what's called the placebo effect. It seems like the men who take this drug are convinced that it works, and so it works, if that makes sense. I might do a whole video on the placebo effect because it's really, really interesting. But from the research, it doesn't seem like these things actually help unless you have erectile dysfunction. There are a variety of reasons why someone would want to do this. You know, when we drink alcohol, that can induce erectile dysfunction. From what I understand, cocaine use can do the same thing, and some men want an extra boost. Here's the thing, it's not necessary. If you don't have erectile dysfunction, it's not really necessary to take it. And if you're someone that struggles with performance anxiety, then therapy is, in my opinion, effective, and it's not necessary to take these drugs, especially when you don't know what's in them. We'll talk about that in a second. Because in 2011, Pfizer, who created Viagra, got so many complaints and saw so much danger in this new trend of street drugs claiming to have Viagra in them. So they created this website, Viagra.com, to give people a proper explanation and understanding of what this drug is, to give more resources to how to get it. And this is a response to fake Viagra pills. These pills did contain Viagra, but 30 to 50% of them had something else. Some of that was speed, amphetamine, drywall used to make the pills, and a bunch of other stuff. The whole point being is that if you get this stuff off the street and it's not prescribed, you really don't know what's in it. Another thing I've seen on social media is these honey packs, this stuff called royal honey. Now I want to make a point about this, just like the Viagra pills. If you're taking this, you don't know what's in it. They claim to have these natural quote unquote testosterone boosters, these plants. They can tell you what they want to tell you. You don't know if it's in there. Upon analysis, I think the FDA did some analysis. These things contain Cialis. The issue is that you don't know how much Cialis is in it. With drugs like this, dosage is very important. Dosage is important with any kind of drug. You shouldn't be taking something and not be aware of what's actually in it. For the most part, the ingredients are unknown. I believe the FDA or some regulating body tried to contact the people that make this, and they didn't get anything back. So you don't know what's in this. Again, like I mentioned before, the placebo effect probably has a lot to do with these things working, and there's very real danger because, again, you don't know what's in it. It's the same with those gas station pills or whatever. This stuff can have side effects simply because who knows what's in it? So who knows what's interacting in your body? And oftentimes people will take stuff like this with alcohol or with other drugs in their system. But when it comes to biology, when it comes to biochemistry, a lot of drugs don't mix well, and a lot of situations don't mix well. It's important to think critically and think about what you're putting in your body, especially with this mystery stuff, because they can write whatever they want on these packages, but you can't trust people who just sell stuff like that and aren't honest and open about what's in it. I want to take a deeper dive into these synthetic or designer drugs. These drugs are called PED5 inhibitors. That's what Viagra and Cialis is. And as I've mentioned before, there are a lot of substances that are based on Viagra. One thing I want to mention is vardenafil, which is not as popular. This is an FDA-approved PED5 inhibitor. Its function is the same as Viagra and Cialis. Now, these synthetic or designer drugs are what are called structural analogs. An analog is a molecule that is structured in a way that's very close to the original. In this case, the original is Viagra. So you have these chemists, I don't know who these people are, but they create drugs that are based off of actual drugs. So this is one case, Viagra. There's so many other drugs that people will synthesize that are very similar to like an MDMA or maybe a cocaine, etc., etc. These drugs are really interesting. So we'll start here. Acetyldenafil is an herbal analog. So a lot of these drugs are drugs that people claim to be natural, quote unquote, or herbal, but they're really synthetic. So we have acetyldenafil, aldenafil, homosildenafil, sulfadenafil, nitrosoprodenafil. Much of these have a very similar structure. So you have this nitrogen group, this sulfur group, nitrogen group, sulfur group, nitrogen group. It's not a sulfur group, it is a similar structure. And then you have this, nitrogen, sulfur, similar structure, nitrogen, sulfur, similar structure, nitrogen, sulfur, similar structure. If you pause, you'll see what I mean. I do this a lot in my videos. You'll see that these structures are very similar to Viagra. And when you compare them, you'll see that there are certain things that are a little different. Let me just take these away. And if you pause and look, you'll see that Viagra is this base structure and they kind of added little things on. But the whole point is that all of these are PED5 inhibitors. The issue is that there's not a lot known about these things. We don't know what they do as far as the other side effects. We don't know how they interact with other drugs. There's a lot of mysteries. And when you're taking drugs, especially prescription drugs, designer drugs, whatever, it's pertinent that you know how they interact in your body and what they do, because you don't want to mess around with fake substances and not know what's in them or what you're really consuming. Thinking critically is really important. Look, people want to have fun, they want to live their life, but you don't want to play with your health. And oftentimes people can consume these things and have fairly serious adverse reactions. So let's discuss some side effects of Viagra and Cialis. These are not all common. So headache, dizziness, stomach pain, fatigue, congestion. Again, these drugs have a pretty good safety profile, especially if you're working with a doctor. A rare side effect that you'll often hear in commercials that surround themselves around PED5 inhibitors is priapism. This is a prolonged erection. I believe in the commercials that I remember, it's an erection lasting 4 hours or more. This can be very painful and can cause structural damage to the penis. A treatment for this, I think the urologist that I work with mentioned this, you take a needle and drain the blood from the penis, or you inject it with phenylephrine, which reduces the erection. And a lot of these side effects aren't extremely common. They can happen, just like any drug has side effects. The dosage and doctor communication is very, very important. Lastly, we'll talk about PED5 inhibitors. So the normal function, and I am leaving out a lot, is you have this molecule cyclic GMP. Now, cyclic GMP is used for smooth muscle relaxation. Your smooth muscle needs to relax in a lot of places in your body. This muscle is usually an automatically controlled muscle. When it relaxes, it controls blood flow. Smooth muscle contraction, for example, this is what causes menstrual pain or cramps caused by these other molecules, but that's what cramps up in those situations. It's also what causes peristalsis. That's a fancy word for the movement of food down the esophagus. When you eat, the food moves down your esophagus because you have muscles that are powered automatically to slowly push that food down into your stomach. So here, cyclic GMP normally will be broken down by PDE5 and then turned into 5' GMP. We don't want to worry about that. If you've noticed in my videos, anytime you have a molecule that does a function, it needs to be broken down because that's part of the bodily process. You never want a situation where a certain molecule isn't broken down and it builds up, because that causes a whole host of issues. So this is a natural process. PED5 inhibitors stop PED5 from working, thus it inhibits the breakdown, causing an increase in cyclic GMP, more blood flow, and easier erection. So there's steps to this thing. Pretty much every drug works by stopping a natural biological process, thus achieving the desired effect, but because of that, you're going to experience side effects. This is kind of how these things work. It's very, very interesting. So let's go through the summary and talk about what we learned today to refresh our minds. We first spoke about Viagra. It's a treatment for erectile dysfunction. It uses the biological process of smooth muscle relaxation. It takes about 20 minutes to kick in, lasts for about 3 to 4 hours, and has an alternative use of treating pulmonary arterial hypertension. We also learned about how an erection happens and how Viagra or Cialis helps with that. Then we talked about Cialis. It pretty much does the same thing Viagra does, except it's also used for an enlarged prostate, and it kicks in about 30 minutes but lasts for 36 hours. So it's a lot longer in its duration in the body. We then got into recreational use. We spoke about how Viagra is the most commonly used ED medication, but a lot of it can be fake. We don't know what's in it. Pfizer had to come out with a new site to give people more information on it. And then you have people taking these royal honey packs. You don't know what's in it. You don't know how it's affecting you. You don't know anything. And you're consuming this substance hoping that it's going to give you a boost when it might affect your health dramatically in ways you don't understand. Then we talked about these synthetic or designer drugs, these analogs, these versions of Viagra that have been synthesized that are PED5 inhibitors, but again, we don't know how this stuff affects the body. We don't know how they interact with other drugs, which causes a very real danger and risk. We spoke about some of the possible side effects of PED5 inhibitors like headache, stomach pain, congestion. We spoke about the rare side effect of priapism, which is prolonged erection. And we discussed how these aren't extremely common, but they can happen. Lastly, we spoke about PED5 inhibitors, how this natural process of smooth muscle relaxation has to do with this molecule. And these drugs stop this molecule from being broken down, increases the levels, thus causing more blood flow and an easier erection. That's all I got. I hope you guys learned a lot. I definitely learned a little bit more than I already knew. As just an extra thought, if you are taking some of these street Viagras or this honey, just be aware that you don't know what you're putting in your body. You're taking a very real risk, and without proper analysis and study, we won't know what's really going on. So, take this stuff with caution. Honestly, in my opinion, it's not worth it to take it, especially if you don't have erectile dysfunction, and especially if you're taking something off the street or in those honey packs, because again, what's in it is a mystery. Thank you so much for watching and listening. Please like, comment, and subscribe. tell your friends, and I'll be back soon with another video.